Hi, my name is Hannah and I'm 28 years old and I have PAH. I started taking Remodulin therapy in July of 2019. I talked with my doctors about the differences between subcutaneous and taking Remodulin through an IV, and I felt that subcutaneous was less invasive and could mostly be managed at home, and I felt like that would be better for my lifestyle. I think the size was honestly the biggest factor for me. I just have my pump in my pocket and I can almost pretend like it's not there. The site is less invasive, there's less concerns about infection, and those things were really important to me when I was making my decision. I was concerned about managing all of the different supplies and equipment and starting a site by myself. I felt a little bit unprepared going in, but felt very confident after I met with the nurse from my pharmacy. She would spend extensive time training me, teaching me what all the supplies were for, and just talking to me about the day-to-day care for the pump and the site. And so a lot of my questions I got answered during that training. She was pretty upfront with me and clear, which I appreciated because I wanted to know what was normal, what to expect. And she just really encouraged me to advocate for myself with my doctors, to reach out to other PAH patients, and to really make sure that I was doing everything I could to get through those periods of site pain. So I felt like she prepared me pretty well. So for me, with site pain, it's really helpful to use some kind of wrap. So keeping the site compressed and keeping the swelling down and keeping it from being bothered while you're moving around is so helpful. And then I think also communicating a clear plan if you have someone that you live with or someone that helps kind of take care of you during the site changes. If there are specific things that people can do for you, like dropping off a meal so that you don't have to cook that week, or helping you with laundry or something like that, just being really clear about how people can support you tangibly. I encourage you to talk to your doctor about Remodulin subcutaneous therapy to see if it's the right treatment for you.
Remodulin Tripostenyl injection. Indication, or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.